So welcome guys to another episode of the Health Vanguard, the Diaspora's guide to caring for your loved ones back home. As you can see, we're outside today. We are in Pirang. Pirang is a small village outside of Birkama as well. And today what we wanted to showcase is what happens outside of our facilities. As you guys know, Innovarx has one major belief that we have, that healthcare should be accessible as somebody's human right. And if you wait for people to come to healthcare facilities, oftentimes you miss a lot of people that don't have the means because there are barriers to accessing care. Transportation, some of our elderly patients who live at home have so many logistics they need to figure out just to make it to a healthcare facility. As part of the plans that we offer to people, like our Assurance Care Plan, every single month our clinical team will go in and do an in-house visit. The whole notion of wellness on wheels comes from that. We're bringing wellness to people where they need it the most, but allows us to follow them on the journey as a companion. One of the most important things about our in-house visits when we go see patients is what is happening around the patient that oftentimes we miss when the patient comes to our facilities. Are they safe? Do they have access to clean water? Who is cooking their meals? Because if somebody has diabetes and the cook at home doesn't understand the relationship between food and disease, you miss a lot. Today, I'm joining the team. You'll get to see how they care for patients, but it's also quality control for me as a founder and CEO. I don't get to get out as often as well, but just being on the ground, getting to meet our patients, see how they're doing, but just observe ways in which we could improve the service offering is great for me. So follow us today and you guys will get to see how we work outside of our main facility. Yeah, so today I have the opportunity to join the in-house crew, Wellness on Wheels. For me, it's once in a blue moon, just going to visit one of our care plan members. But for them, this is every day. When we were building Innovarx Global Health, we decided that a lot of the patients, transportation is one of the biggest barriers to care, especially if they're elderly. Most of the times, these people live at home. They may have house help, but just getting to a healthcare facility is so difficult. So even most people that have an Assurance Care Plan, for example, every single month, we have this team that goes to them just to do basic things. And obviously in the car, usually, you'll have the logistics guy, our driver, who navigates where these people live. And always, every single trip will include a nurse who you'll get to know what she does, and a physiotherapist as well too. But I think it's one of the most valuable services that we offer to people that have the care plan, because once again, healthcare has to be continuous. And if you rely somebody who has a confirmed diagnosis to always have to come to you, it becomes a challenge. But maybe obviously today we have Sita, who's a nurse, so she'll kind of give you a little bit of idea of what her day starts like. And then we'll have Ibrahim also, who's a physiotherapist, just kind of share his thoughts about what this in-house experience is in terms of our service delivery.
I would just like to say the in-house services are actually one of the most important aspects of Innovarx, because in this way we have accessibility to healthcare. There are patients who are bedridden, some are facing it difficult to have transportation, especially patients that live very far. Some are very close but yet need attention, especially at home. Some will have the access to know their numbers from home. These are very, very important because at times we don't do those regular checkups as necessary, like going to health centers time to time to know our numbers or to know how far our medication therapy is or our nutrition. But with these in-services, we are able to actually have that opportunity to reach out to these patients, provide the care that is needed, and ensure that their health is improved. So as a nurse, this is a very important step for me, and it is something that helps me keep in touch with my patients and ensure that they are doing well and are able to connect with us.
So, and going back to what the nurse says, I think thinking about it from a diaspora perspective, if you are in the diaspora, this is what gives you peace of mind, because you know that when the nurses go and the clinicians go, it's more than just healthcare. They're looking at the physical well-being of your loved one. Do they feel safe? Is somebody who's at home cooking for them? Are you taking them along the journey? So when we talk about lifetime companionship, you involve the entire ecosystem around somebody that you love. And the beauty of technology is everything that they do in people's homes, they have access to our clinical records. So with the doctors that are at the facility, they're able to do their work on the road. But Ibrahima will definitely kind of give you an idea in terms of how we transform the in-house care to also include like movement. So Ibrahima, you could touch on that a little bit.
Thank you, Dr. Baji. I am Ibrahima. I'm here joining the team again for in-house that we normally do on a daily basis, visiting our patients. Okay, my role as a physiotherapist in this in-house is assessing the patient's mobility and movement of the patient to see how the patient is living, how the patient is in terms of mobility. The importance of involving the family members is to make it easy for the patient to be able to do things on their own. Because when you involve the family member, that is the time they know that they don't have to do everything for the patient, that they have to let the patient try for themselves. They can support, but minimal support. And I tend to train the patient on how to do things on their own and how the family member could assist in terms of mobility, in terms of patient moving from one place to another. And I tend to give them exercise that they were doing, which will help them to gain their strength.
Yeah, so essentially that's why when we say wellness on wheels, that's literally what we mean. But also this idea of patient-centered care, we pride ourselves on one patient. The psychological safety of a patient when you show up where in that moment for 30 minutes or an hour, you are the center of attraction. You have a nurse, you have a physiotherapist, sometimes the pharmacy team. People underestimate what that does to elderly patients, especially who sometimes struggle with loneliness. They may feel like they're not receiving the care and attention that they need. So we think sometimes healthcare is more psychological, but our trips are so essential when it comes to just providing peace of mind for people in the diaspora. But you guys will get to see it in real life. So we look forward to at least showing you how the work that we do is done, and in parts of Gambia where oftentimes quality is reserved for people who live in the urban center. How are you?
I have a problem with my chest. I cannot talk much.
Okay.
I have hiccup.
Okay.
This is very strong.
How often? How long has it been going on?
It's been going on for 5 years now.
Okay.
It's 2021.
Okay. Does it get better or worse, or no, not really?
It's getting worse every day.
Okay. Is it affecting how you eat? Is it affecting his appetite? Or no?
No, it's too loud.
Okay.
It was.
That's good. Well, they're here for the visit again. I came with them today so that one, you could get to meet me. Oftentimes, I'm at the office. They're the ones who are in the field.
I think I had 3 visits.
Okay.
I did not see it.
Yes.
The female doctor.
Yes, Dr. Sanyak. Yes, Dr. Sanyak. But the visit today, it's going to be the same thing. They'll check your vitals. Have you met Ibrahima before? The physiotherapist. Yes. You're always here with Dad. You're always here with him.
Yes,
Okay.
except for the last 2 months.
Okay. So
Always meet him here, but always they used to meet me.
okay, that's good. So you know the process and how it typically works. This is Sira. Sira's a nurse, and Fatimata as well too is a nurse, as well too. They're the ones who do the work. I'm just gonna observe and at least allow them to. Is he taking medications?
Yes.
Do you have them?
Yeah.
Okay, if you want to bring them. Are they giving you anything for your hiccups?
Well, it's not, we call it gabapentin. That is what I'm taking.
Okay. Well, okay, I'll allow Sira to get started, and I'll look at the medications as well too, so she could do the vitals. So you go ahead, yeah.
How are you doing today?
She used to come here.
Right. How are you doing today?
I'm finding it difficult today.
You're finding it difficult with the chest.
Okay. What state?
The hiccups. Aside the hiccups, do you cough?
Okay.
No, I don't cough.
You don't cough. Just hiccup. Okay. Do you have shortness of breath? Shortness of breath. Do you find it difficult to breathe?
Yeah, where the heat of it here.
Mm-hmm.
I find it very
Difficult to breathe.
I cannot even talk.
You cannot talk. Okay. Any other complaints aside these complaints?
And it's general body pain.
General body pain.
Yeah, it's from time to time. But
Time
not
to time,
always.
not always.
But today I'm suffering from it.
Okay. You feel dizzy or any other thing?
Sometimes.
Sometimes you feel dizzy. But right now, no dizziness.
Right now.
There's no dizziness. Any other thing you would want me to know? Any other complaint you would want me to note down?
That is sleeping.
Sleeping.
It's a problem.
You have a sleeping difficulty. You sleep and wake up. Sleep and wake up. Yeah, that's insomnia.
These days he's complaining that he wake up by
Okay. How about the appetite? Are you eating well?
I'm eating
You're eating good.
not very good.
Not very good.
I cannot take much of the stomach.
You cannot take much.
In the stomach. If I do, it troubles me.
Okay.
Go to bed.
All right. So you're taking your medications
Yes.
as prescribed.
Yeah, so
Can I have them?
Ahmad is the one who's packaging it really well.
Aside these medications, are you taking any other medication?
No.
No. Okay.
Okay, so we need to find a way of getting him protein. Yes, because his diet, he needs protein, especially for his muscle mass, you know? Yeah. Typically milk will be easier, but because we have to get him protein. So his diet, it cannot be only carbohydrates. At least he needs some protein as well. Ibrahima will do a mobility
Balance.
assessment. You see, because more at his age, you realize that the strength is muscle. Yeah. So he needs to have a balanced diet as well. It's good for energy. The Quaker oats and stuff is good for energy and it's easy to digest. But we need to see what type of protein would he tolerate so that at least he's getting one serving of protein a day. All right, so while the nurses and the team are doing their routine checkups, I just wanted to talk about our care code. When we talk about psychological safety at Innovarx, this is what we mean. This patient, there's no other environment that he'll be most comfortable than his home. But it's also a great thing when we see our patients that have a really strong support system, be it their spouses or their elder, one of their sons or their daughters, especially with the diaspora, because most families in the diaspora, they may have siblings who are outside, but they may have siblings that are home. Yeah. And the siblings that are home are one of the most critical people. We call them partners in care because they're the ones fixing the medications, making sure every single day we're talking to them about how, how's the appetite, how's our patient sleeping. So they are such good sources of information. It really allows our clinicians to know. And that's why when we say psychological safety, it's always step number one, but clarity of communication. If we have elderly patients where somebody like him may be in his 80s, we get the most clear source of information from the family members. And obviously the co-equal ownership. It's always patient, provider, and family member or sponsor. We have a three-way system when it comes to just all of us being on the same page to see how we could provide care. And it's always good as well for me to see quality control perspective, some of our nurses, how are their bedside manner, our patients actually getting, the services that they offer. But psychological safety, there's no more peaceful place than somebody who's going to provide care.
Waaw su ma yàggee toog su ma toogee bu yàgg.
Waaw.
nga dee niiw.
ma dee nii. baal ma nga dox fii sama seet.
Naa bañ ko ben sambaloo jam banaa ko rek.
am daala du muy.
Ma foog daal.
Okay, thank
da nga dem mën a dox teewuloo banta bi.
Sorry about
Waaw léegi kay duma tiiwee.
Do you feel any pain when doing that?
No.
This one, try raise that up, let me see.
But I can't go beyond that. It's from somebody else.
Okay, unless you get a support.
Yeah.
But it hurts, you feel the pain, right?
Pain.
Okay, put it down. Sorry. But this one goes fine, right?
This one is going to go a bit
So it's like on the right.
On the right, yes. For the knees, you don't feel no pain at all. Can you raise the leg up like this? Put it down. Now do it on your own. Down. Okay, that's fine. Let me see this one. Down. Again. Down. All right, that's fine. That's fine. So, mostly when you're sleeping, tend to use this side more than this side, okay?
If I do this
Yes, this hurts as well.
for about an hour, it will wake me up.
It will wake you up. Okay. Now, I'm going to give you an exercise you'll be doing to help with the shoulder mobility, okay? Let me have this. Put this down. Put it down. Do your hands like this. Do your hands like this. No, like this. Like this. Now you raise it up. While this one will support this. Let's go. Sun to ha. Good. And then you bring it down. Because it cannot go up alone, right? So this will support it and you move it up. Good. All the way up and down. Okay? So add this to your routine. When you walk around in the morning, add this exercise to your routine. Okay? It's going to help you with the shoulder mobility. Okay? And if the pain keeps happening, yes. If the pain keeps happening, you can do a warm compression, get a hot towel, warm towel, and just place it there, and then you can just get a balm and massage it a little bit. Okay? Yeah.
Good meeting you. I'll talk to John. I'll talk to Lamin. Tell him that I saw Dad today. I'll leave him a message. Next time I'm in New York, I'll stop by and say hello. Okay, Mero.
Okay, Dad. Thank you so much. You have a good day. Okay. Mera baraka. Mulkata. Amin.
Yeah, so wrapping up this special episode of the Health Vanguard, just wanted to start off by saying how amazing this visit was. So many times we don't get to see the impact of the work that the clinicians are doing. But what we do is really a partnership. The family we just saw, I can't thank the family members in the diaspora enough for just being proactive with their care. It's always great when there's an entire family philosophy around healthcare where the siblings who may not be in Gambia are investing in proactiveness, but also the family members that are home are really prioritizing their health. So I just wanted to show that if you're in the diaspora, healthcare is something where it's a collective responsibility. And the beauty about Africa is, as we're leaving, even just a piece of fruit as a token of appreciation, makes you remember that we really are just one people, one nation. But yeah, I hope you guys enjoyed to see how doing work in the field looks like. Until we see you guys again on the Health Vanguard show. But always remember, if you love somebody in Gambia, don't wait till it's too late to start your care. So thank you.